Arias. Thanks for joining us from Allergy, Asthma Specialist. How are you today?
I'm doing good, very good. Thank you very much. I appreciate you interviewing me for this, and hopefully we can help some patients out there so as they watch this.
Definitely. Thanks for your time, and let's go right to it. Um, what have you seen since the outbreak of COVID-19 in your practice?
Well, actually, what I'm seeing is I'm actually seeing less patients. We're not seeing any sick patients. They're being screened over the phone, and when they get here, and anybody with a fever or a cough, unless they have asthma, of course, but they have a cough, are being told to go to the local emergency room or central care.
Okay, and you're an expert in asthma patients. What precautions those people that have asthma need to take in to prevent COVID-19?
Well, the recommendations for the governing bodies that tell me how to practice allergy and asthma are recommending that any patients with asthma, that they stay on their inhalers. Their daily controllers is what they're called. Daily controllers or daily inhaled corticosteroids or daily asthma medications, that they stay on it on a regular basis. So their asthma is controlled. In case they do get the COVID-19, their asthma will be having less flare-ups. And really what's happening is the patients are not really fighting me when I tell them that they need to go on their medications, and I tell them the reason why. Most of the time, patients tend to stop their medications when they feel better, but this time I'm noticing that when I explain to them the reason why they need to stay on it, the patients are actually staying on it, which is good for them.
Oh, that's good to hear.
Yes.
Dr. Arias, what are the complications, let's say someone who has asthma contracts COVID-19? If you can tell us, high level, what are the worsening conditions with someone who has underlying conditions?
Well, remember, asthma is a chronic condition, so it puts you at risk for, COVID-19. So asthma mostly is having a cough, wheezing, shortness of breath, or chest tightness. So definitely, if you get a virus, even a regular cold virus, I'm just not talking COVID-19, even a regular virus that we get every winter, the asthma tends to exacerbate, is what we call it, or tends to get worse. So you're going to have worsening of the cough, worsening of the symptoms of wheezing, shortness of breath, and chest tightness. So immediately when a patient with asthma has these symptoms, and especially if they have a fever, they immediately should go to the nearest emergency room.
Thank you, doctor. What have you seen? Have you adjusted? You mentioned earlier that you guys are seeing patients via phone or telemedicine. What have you done in your practice since the outbreak? How are you guys adjusting to this?
Well, the adjustment is, of course, we have the separations in the seats in the waiting room. The other thing is we put a tape when patients walk in so they can stay far apart and not get near the staff as much as possible. All the staff is wearing masks. When you come into the room, once you leave, we completely disinfect the room totally, and we close the room, let everything dry out before we use the room again. And the staff is wearing masks. And again, if a patient calls, when we are taking their vital signs, we notice that they have a fever, they're not being seen, they're being told to go to the nearest emergency room. Or central care, because central care is also doing COVID-19 testing.
Okay, so they should call in advance before going into
Yes.
the facility.
Yes.
Got it. So I was looking at social media, and I also saw one of your posts, and I have seen several posts of people who have some sort of, let's say, side effect to all of the things that are going, contact dermatitis. I have seen people with severe rash in their hands. You have seen it. Why is that? Can we talk a little bit about that? What is contact dermatitis?
Yes. I've seen a couple of patients. Let me tell you about the patients, and then I'll tell you what's going on. So I saw a dentist in one of my office who had been using a lot of the hand sanitizers, and then he got a rash on his hands. He thought it was latex allergies, which is rare because most dentists hardly use any latex. So we tested him to latex, and he was negative. And then we figure out that it was a hand sanitizer he was using. So I recommend more hand washing with a mild soap instead of using so much of the hand sanitizer if possible. Then I saw 2 females last week with the same thing, with a dermatitis, redness, itching at the hand, which is a contact dermatitis, which is a rash or dermatitis that you get from the chemicals in these soaps. and then these hand sanitizers. So again, what I did with them is I gave them a topical steroid prescription and told them to switch to a dye-free, fragrance-free soap. Like, for example, a Dove-sensitive soap is one of them, or something similar to it where it does not have any dyes or any fragrance to avoid the contact dermatitis.
Wow. And why is it so important to seek treatment when you have this type of rash? Is it because you have an ulceration and you can get more bacteria?
You got it. Yes.
That you need to get
Correct. Yeah, we want to make sure that the skin barrier, the skin is not broken, because exactly what you said. If they have the rash, then the itching, then they start scratching, then they get a broken skin, and that could lead to infections. Correct. So we want to address it immediately.
I know you said it already, but how can we prevent to have that? Instead of using that antibacterial soap, use water and soap. Do you recommend like an antibacterial bar soap or gel soap, something like that, instead of the actual hand sanitizer?
Well, regular.
Let's say you're home and you're not outside.
If you're at home, the best thing to do is remember 20 seconds of hand washing with a mild soap, which normally means that normally on the soap it will say dye-free, fragrance-free. The antibacterial soaps, the chemical in the antibacterial soap, the last time that I read on it, is being taken off the market because it has not been found to be really that effective as far as being antibacterial, and they also can cause some rashes. So it is being taken off the market eventually. So a mild soap, dye-free, fragrance-free.
Okay. And for someone who has this, can they see the doctor via telemedicine, or they have to actually go to the office? What will you recommend?
Oh, we are able to see patients in the office, and we're also able to do telemedicine through our office or company, Allergy, Asthma Specialist. So either one can work for the patient.
Okay. And then how can people get in touch with you and your team at your office?
Well, they can go on our website at allergycfl.com. That will have all the 5 offices locations, and that way they can go to the location that's near their home.
Perfect. Okay, before we end this interview with you, what do you recommend for people who are watching us right now and they may have an underlying condition?
If they have an underlying chronic condition, the best option, of course, is to stay home. If they do need to go out to the regular grocery store, it definitely would be to wear a mask and to wash your hands as soon as they're able to with a mild soap.
Perfect. Well, thank you, Dr. Jose Arias, for joining us today. I know you're a very busy doctor, seeing a lot of patients and taking care of the EO here in Central Florida. Thank you for your time, and stay safe.
Thank you. You too. Thank you very much for this interview. I appreciate it. I hope it's able to help a few patients.